Heart Conditions, Risk Factors, and Treatment, presented by the Chatham-Kent Community Health Center's Cardiac Rehab Program. Learning more about your condition is an important piece of self-management. During this video, we review the anatomy of the heart, common heart conditions and medications, as well as various risk factors for heart disease. Please note that this video is for information purposes only and does not replace the need for medical care or recommendations from your healthcare provider. First, we will review the anatomy of the heart. The heart is a muscular pump with 4 chambers, the right atrium and ventricle, and left atrium and ventricle. There are 4 valves at the exit of each chamber, responsible for one-way blood flow through the heart to the lungs and the rest of the body. The entire organ is about the size of your fist. Blood for the heart is supplied by the coronary arteries. The heart pumps blood throughout the body, delivering nutrients and oxygen, and removing waste products and carbon dioxide. The right side of the heart receives the oxygen-poor blood from the veins, and the left side of the heart contains the oxygen-rich blood to be pumped throughout the body through the arteries. When someone listens to your heartbeat with a stethoscope, they are hearing the opening and closing of the heart valves. The average heartbeat, or pulse, is 60 to 100 beats per minute, roughly 100,000 beats per day. The heart rate and rhythm are controlled by an electrical system within the heart. Common heart conditions. Angina. Angina is chest pain or discomfort caused by a temporary disruption in the flow of blood and oxygen to the heart. It's your heart's way of telling you that it needs more oxygen. Symptoms include pain or discomfort that can spread to the chest, jaw, shoulders, arms, and back. Sometimes the pain or discomfort is described as a tightness, burning, heaviness, or squeezing. You may also feel dizziness, paleness, or weakness. If you are experiencing any of these symptoms for the first time, seek immediate medical attention by going to the emergency department. If you have a diagnosis of angina, rest and/or take your medication for angina. If your medication isn't working, or if your symptoms are unusual, seek immediate medical attention by going to the emergency department. With angina, the symptoms usually only last a few minutes. Angina can be brought on by physical activity, stress, being in a very cold place, or even after eating a large meal. Angina can be caused by a number of medical conditions, including coronary artery disease, coronary artery spasm, high blood pressure, narrowing of the valves in the heart, or with an enlarged heart. Arrhythmias. An arrhythmia is an abnormal heartbeat. The heartbeat may be too fast, too slow, or irregular in rhythm. Atrial fibrillation is the most common type of arrhythmia and occurs when the electrical signals in the heart are fast, irregular, and disorganized, causing the heart to not pump as efficiently. Arrhythmias can be caused by many things, including damage to the heart, high blood pressure, heart valve disease, congenital heart disease, cardiomyopathy, inherited disorders, diabetes, thyroid problems, alcohol, caffeine, smoking, drugs and supplements, stress, and sleep apnea. The symptoms you can experience with an arrhythmia will depend on the type of arrhythmia. Symptoms may include palpitations, dizziness, fainting, fatigue, shortness of breath, having a strong pulse in the neck, fluttering or racing heartbeat, weakness, and sweating. Arrhythmias unfortunately can be fatal. Atherosclerosis. Atherosclerosis occurs when the arteries become narrow and thick due to the buildup of plaque, leading to blockages and disrupted blood flow. There are no symptoms present until it has progressed enough to lead to a blockage of a major blood vessel. Not only can the plaque buildup contribute to blockages, they can also break off and a blood clot can form at the break, also impeding blood flow. The clot can travel through the bloodstream and disrupt blood flow to other areas of the body. Everyone experiences atherosclerosis to some degree, but people usually don't have symptoms until the artery is blocked by at least 50%. When atherosclerosis occurs in the heart arteries, this is called coronary artery disease and can cause angina or a heart attack. Atherosclerosis can also occur in the carotids or arteries in the neck, leading to a stroke or a TIA. Atherosclerosis in the leg or arm arteries is called peripheral artery disease and can cause muscular pain. It can also occur elsewhere in the body and increase the risk for organ damage. Causes may include high blood pressure that is uncontrolled, high cholesterol and triglycerides, uncontrolled diabetes, and chemicals from smoking cigarettes. Cardiomyopathy. Cardiomyopathy is a diagnosis whereby the heart muscle is damaged and causes the heart to be unable to pump blood efficiently throughout the body. There are different types of cardiomyopathy. The heart muscle may be too thin, too thick, damaged, or weakened. It can lead to heart failure. Causes include genetic conditions, congenital heart disease, damage from a heart attack or an infection, chronic fast heart rate, valve disease, high blood pressure, unhealthy weight, diabetes, excessive alcohol intake, recreational drug use, low intake of essential vitamins and minerals such as thiamine, connective tissue disorders, thyroid disease, pregnancy complications, and some chemotherapy and radiation treatments. The symptoms of cardiomyopathy may include palpitations, fainting, lightheadedness, shortness of breath, irregular heartbeats, swelling in the hands or feet, abdominal bloating, cough when laying down, dizziness, heart murmurs, or chest pain. Coronary artery disease. Coronary artery disease is the most common heart disease. Narrowing or blockages occur, impeding adequate blood flow to the heart. There are many risk factors associated with coronary artery disease. Some are modifiable, such as lifestyle factors, and others are non-modifiable, such as our age, family history, and ethnic background. Coronary artery disease is caused by plaque buildup on the walls of the arteries. Plaque is made up of fatty substances, such as cholesterol, as well as calcium and waste products from cells. The plaque can narrow or block the arteries, or rupture and create a blood clot. Symptoms may include fatigue, pain, dizziness, angina, vague chest discomfort, sleep difficulties, indigestion, or anxiety. Heart attacks. A heart attack is a serious cardiac event that occurs when the supply of blood to the heart muscle is reduced or stopped, causing the heart muscle to die. The length of time that the blood supply is compromised will determine the severity of the heart damage. The damage is irreversible as the cells of the heart do not reproduce. There are two types of heart attacks. The first is a STEMI or ST elevation myocardial infarction. This is a complete blockage of blood flow to the coronary artery. The second is an NSTEMI or non-ST elevation myocardial infarction. This is when a partial blockage occurs. An ECG will determine the type and corresponding location of the damage. Causes of a heart attack include atherosclerosis or coronary artery spasm. Symptoms of a heart attack may include chest discomfort, this is the most common symptom, sweating, discomfort in the neck, jaw, shoulders, arms, or back, nausea or indigestion, shortness of breath, and feeling lightheaded. It is important to know that the presentation of symptoms can be very different from person to person. Symptoms may come on gradually or suddenly, and not everyone will experience chest pain. Some may have mild symptoms, only one symptom, or a combination of symptoms. A heart attack is a medical emergency. Call 911 immediately. Heart failure. Heart failure is a chronic condition that occurs when the heart is too weak, too stiff, or both. This causes the heart to not function properly. While there is no cure for heart failure, you can manage this condition by living a healthy lifestyle. Causes may include damaged heart muscle from a heart attack, coronary artery disease, high blood pressure. Less common causes include heart valve disease, congenital heart disease, myocarditis, arrhythmias, thyroid diseases, or anemia. Symptoms of heart failure may include fatigue, swelling in the legs or abdomen, shortness of breath, especially when laying flat, sudden weight increase, 3 pounds in a day or 5 pounds in a week, bloating, cough or cold symptoms that last for longer than a week, loss of appetite, increased urination at night, cool extremities, and the new onset of confusion or trouble thinking clearly. It is important if you have heart failure to weigh yourself daily in the morning and keep a record of your weights. You should also monitor your symptoms and recognize when changes occur and when to seek follow-up with your healthcare provider. You may need to limit your fluid intake to no more than 2 liters per day and limit salt intake to less than 2,000 milligrams per day, or 1,500 milligrams if you have high blood pressure. Other healthy lifestyle factors include keeping physically active, getting plenty of sleep, managing your stress levels and monitoring your mental health, eating a healthy diet including plenty of fiber, and follow recommendations from your healthcare provider about alcohol intake, decreasing or avoiding caffeine, being smoke-free, and staying up to date with your vaccinations. Heart valve disease. As mentioned at the beginning of this video, there are 4 heart valves, one at each exit of the 4 chambers of the heart. Diseases of the heart valves include valvular stenosis or narrowing, valvular prolapse, slipping out of place, and regurgitation or leaking. Causes of heart valve diseases include congenital causes, rheumatic fever, infective endocarditis, radiation therapy, normal wear and tear of aging, coronary artery disease, damaged heart muscle, cardiomyopathy, metabolic disorders, tumors, and certain medications. If you have a heart valve disease, you may experience angina, heart palpitations, fatigue or weakness, feeling lightheaded, dizzy, near fainting, or swelling. There are a number of ways to treat cardiac conditions, including lifestyle changes, procedures, and surgeries. Medications are commonly a part of an individual's cardiac treatment. The following section will review common cardiac medication groups. On each slide, you will also find a list of medications within each group. Both the generic and brand names are included for your reference. ACE inhibitors. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, are a class of medications used to lower your blood pressure, protect your heart muscle, and makes it easier for your heart to pump. They are also used to protect the kidneys in people with diabetes or kidney disease, to treat heart failure, people at risk for coronary artery disease, or to prevent issues after a heart attack. It is important to note that these medications can increase the potassium in your body, so salt substitutes or potassium supplements should be avoided unless you are prescribed them by your healthcare provider. Side effects may include dizziness as a result of low blood pressure or a dry cough or tickle in the throat. Angiotensin II receptor blockers. Angiotensin II receptor blockers are used to treat high blood pressure and heart failure by relaxing blood vessels. These medications may increase your potassium levels, so only take potassium supplements if advised to do so by your healthcare provider. If you take these medications with other medications such as ibuprofen, naproxen, or indomethacin, it may increase your blood pressure, so talk to your healthcare provider about using these medications together. Some side effects of angiotensin II receptor blockers include dizziness and lightheadedness. Antiarrhythmics. Arrhythmias occur when the electrical system of your heart is disrupted. Antiarrhythmic medications slow down the electrical impulses in the heart, allowing the heart to beat regularly again. There are different types of antiarrhythmic medications, including beta blockers, calcium channel blockers, potassium channel blockers, and sodium channel blockers. We will talk later about beta blockers and calcium channel blockers in more detail. Some side effects may include sun sensitivity, so be sure to wear sunscreen, dizziness, urine retention, blurred vision, gastrointestinal upset, or seizures. Some beta blockers and the medication xylitol can make asthma symptoms worse, so be sure to tell your healthcare provider if you have asthma. Anticoagulants. Anticoagulants prevent the formation of blood clots or prevent existing blood clots from becoming bigger. They may be taken by people with artificial heart valves, atrial fibrillation, cardiomyopathy, or who have had a heart attack. Anticoagulants such as warfarin may require blood tests to monitor your clotting time. It is very important to let your healthcare providers know if you are taking anticoagulants, as this may be an important piece for planning dental work or surgery. The medication warfarin is affected by vitamin K intake. Vitamin K is found in dark green leafy vegetables. It is important to keep your vitamin K intake consistent day to day, as this may affect how well your warfarin works. The biggest side effect with anticoagulants is abnormal bleeding. Take care to avoid cutting yourself and seek immediate medical attention if you sustain a serious fall or injury where bleeding could occur. Watch for signs of excessive or abnormal bleeding, including pink in the sink when brushing your teeth or shaving, vomit with noticeable blood or coffee ground appearance, pink or brown urine, red or black stool, or nosebleeds. Beta blockers. Beta blockers help to reduce how hard your heart has to work, thereby lowering your heart rate and blood pressure. Some beta blockers also protect and strengthen weakened heart muscle. It is important to let your provider know if you have asthma, as some beta blockers can increase airway reactivity and interfere with asthma medications. Side effects of beta blockers may include dizziness, lightheadedness, feeling faint, drowsiness, fatigue, swelling of the feet and ankles, wheezing, trouble breathing, depression, nightmares, cold hands and feet, and decreased sexual ability. Calcium channel blockers. Calcium channel blockers dilate and relax blood vessels, which in turn reduces blood pressure and heart rate. Calcium channel blockers are also helpful for managing arrhythmias, as they can control irregular heartbeats and reduce chest pain from angina. Avoid grapefruit or grapefruit juice when taking calcium channel blockers, as it can increase the effects of some calcium channel blockers, making your blood pressure go too low. Side effects may include fatigue, dizziness, heartburn, or swelling in the ankles or feet. Diuretics. Diuretics, or water pills, are used for treating heart failure and high blood pressure by increasing urination and removing excess fluid and salt from the body. As a result, it is easier for your heart to pump. Excess fluid and salt in the body can cause edema and shortness of breath. Because diuretics will increase urination, take them at least 6 hours before bedtime to avoid getting up in the night. Potassium supplements may be needed when taking diuretics. Your provider will prescribe a potassium supplement if needed. Side effects may include dehydration, dizziness, upset stomach, and in the case of furosemide or Lasix, sun sensitivity. Nitroglycerin. Nitroglycerin is a common medication used for treating chest pain and chest pressure. There are a number of formulations of nitroglycerin. For the purposes of today's learning, we will be referring to the nitroglycerin patch and sublingual tablets and spray only. Nitroglycerin widens your blood vessels to improve the flow of oxygenated blood throughout the body, including the heart. This reduces the workload on your heart as well. Medications used to treat erectile dysfunction, including Viagra, cannot be taken within a certain time period of nitroglycerin, and vice versa, as this can cause serious effects such as lowered blood pressure and fainting. Always inform your healthcare providers of every medication that you take. You should also avoid alcohol with these medications, as it can increase the drug's effects. Talk to your provider if the nitroglycerin stops working well for you. Tolerance can occur if taking more of the medication or taking it more often than you have been instructed. Side effects may include dizziness, headaches, flushing, mouth tingling or burning, and skin irritation with the nitroglycerin patch. Your healthcare provider will tell you how to take your nitroglycerin. Be sure that you know what your dose is, how often you can take a dose, and when you may need to get further medical attention. You can pause the video here to review the specific instructions for your type of nitroglycerin. Cholesterol-lowering medications. Statins are the most common class of cholesterol-lowering medications. Other classes of cholesterol medications are available and may be used in addition to statins or on their own. In addition to lifestyle changes, statins can help to normalize the cholesterol levels, particularly the LDL or unhealthy cholesterol. Statins reduce the LDL cholesterol by reducing how much cholesterol the body produces and increasing how much cholesterol is removed by the liver. They can also lower triglycerides and reduce inflammation in the body. It is important to avoid grapefruit and grapefruit juice, as consuming these may increase the risk of side effects with statins. Side effects may include muscle aches and weakness. We have reviewed some of the common heart conditions and cardiac medication groups in this presentation. For more information about other heart conditions and more information about medications, please go to www.heartandstroke.ca. Keep in mind these key principles of medication use. Always keep an up-to-date medication list. You can usually obtain this from your pharmacy, and be sure to include any other vitamins, supplements, or over-the-counter medications you may be taking as well. Always talk to your pharmacist or primary care provider before starting any over-the-counter medications, vitamins, or supplements. Some medications may interact with your prescriptions, so it is important to check this first. Over-the-counter decongestants, for example, can raise blood pressure and may not be appropriate for those with hypertension or heart disease. Take your medications as prescribed for the best effect. Talk to your pharmacy or healthcare provider if you have questions about your medications and how to take them. If you're experiencing side effects, talk to your pharmacist or healthcare provider right away. Also be mindful of expiry dates, and talk to your pharmacist about having an annual medication review. This next section of our video will cover both non-modifiable and modifiable risk factors for cardiac health. Risk factors for heart disease. Non-modifiable risk factors for heart disease include those that we are unable to change, such as our age, gender, ethnicity, and family history. After the age of 55, our risk for heart disease increases. Women who are postmenopausal are at a higher risk for heart disease. Individuals who are of African, South Asian, First Nation, Métis, and Inuit descent have a higher risk for heart disease. Family history is also a factor. Those with a close male relative who had heart disease before the age of 55, or a close female relative who had heart disease before menopause, are at a higher risk for heart disease themselves. We will focus our attention on modifiable risk factors for heart disease. Weight and waist circumference. A healthy weight is an important part of keeping your heart well. Being overweight increases the risk for diabetes and high blood pressure. Two measures that can be helpful for determining risk include body mass index, or BMI, and waist circumference. The BMI is a calculation between height and weight. A healthy BMI is equal to or over 18.5 and under 25. Waist circumference is also indicative of risk for high blood pressure, high cholesterol, and type 2 diabetes. The parameters for a healthy waist circumference are dependent on your sex and ethnicity. Check with your healthcare provider to determine what is a healthy waist circumference for you. If you are working towards a healthy weight, a small, steady weight loss is much healthier than dropping a large amount of weight very quickly, and you are more likely to maintain that weight loss when done slowly and steady. Eat more fruits, vegetables, and whole grains. It is important to have variety in your diet as well. Be physically active. Physical activity is essential for maintaining a healthy weight. A registered dietitian is an excellent resource when it comes to working towards your health and nutrition goals. Alcohol and recreational drugs. The Canadian Centre on Substance Abuse and Addiction released a publication in January 2023 providing updated guidance on alcohol and health. There are no health benefits to consuming alcohol. The more alcohol consumed, the higher the risk for health problems. 1 to 2 drinks per week is considered low risk for alcohol-related problems to both yourself and others. Substances such as amphetamines, cocaine, ecstasy, opioids, LSD, and PCP can increase the risk of stroke and heart disease. Similarly, research on cannabis use has demonstrated an increased risk of heart disease and stroke. For more information, visit the Heart and Stroke website. Smoking. Smoking is a leading preventable primary risk factor for cardiovascular disease. It increases the risk for heart attack, stroke, blood clots, and atherosclerosis. It increases blood pressure and heart rate and can raise your LDL cholesterol and triglycerides. It reduces oxygen in the blood and HDL or healthy cholesterol. People who continue to smoke after they have had percutaneous coronary intervention by coronary angiogram or bypass surgery have worse outcomes and significantly higher mortality compared to people who quit smoking. Avoiding secondhand smoke is important also, as exposure can increase a non-smoker's risk of cardiovascular disease. There are many supports available to help quit or reduce smoking, including counseling supports and medications, some of which may be at no cost. Talk to your healthcare provider to learn more about supports for quitting when you're ready. You can also visit www.smokershelpline.ca for more information. Cholesterol. Cholesterol levels are an important risk factor for cardiac health. High levels of cholesterol in the blood increases the risk of heart disease, heart attack, and stroke. Regularly checking your lipid profile, which includes your cholesterol levels, will help to monitor your risk and if your levels are within target. There are a number of medications that help to normalize cholesterol levels, but it is important to recognize that many lifestyle factors can impact your cholesterol numbers as well. Consider these dietary strategies for managing your cholesterol. Increase intake of monounsaturated fats. Examples: fish, olive oil, nuts, and seeds. Eliminate or reduce trans fats, for example, French fries, candy bars, store-bought cookies and cakes, and fast food. And reduce saturated fat, for example, processed meats, butter, high-fat dairy. Include plant sterols in your diet. These would be found in nuts, whole grains, vegetables, and fruit. Add more soluble fiber into your diet. For example, pulses or legumes, whole grains, fruits, and vegetables. Include more plant proteins. In addition to these dietary strategies, you should increase your physical activity to aim for at least 150 minutes per week and maintain a healthy weight and waist circumference. Blood pressure. High blood pressure or hypertension is a major risk factor for a number of heart conditions. Hypertension causes the heart to pump harder to be able to move blood throughout the body. Two numbers are used to represent blood pressure. The top number is the systolic blood pressure, which measures the pressure against the walls of the arteries when the heart is contracting. The bottom number is the diastolic blood pressure, which measures the pressure when the heart is relaxed between beats. Lifestyle has a significant role in blood pressure control. A healthy diet, regular exercise, maintaining a healthy weight, not smoking cigarettes, minimizing alcohol intake, and managing stress all contribute to a healthy blood pressure. Check your blood pressure regularly and keep a record of your readings to bring to your medical appointments. When checking your blood pressure at home or in the community, make sure you keep your feet flat on the ground without ankles or knees crossed, and wait at least 30 minutes after consuming caffeine before you take a reading. Stress. Stress can be hard on the heart and increase the risk of coronary artery disease. We all experience stress throughout our lives, but how we cope with and respond to stress is important. Learning and practicing stress management techniques can be very helpful. Techniques might include deep breathing, meditation, or yoga. Living a healthy lifestyle will also help with stress management. Getting proper rest and adequate sleep are paramount. Eat a healthy, balanced diet. Reduce your alcohol and caffeine intake. Exercise regularly. There are so many benefits to regular exercise, including for our mental health. Quit smoking and make time for fun and relaxation, and set goals. Learn to prioritize and say no when necessary. Chronic stress can take a toll on the body, but also on the mind. It can lead to anxiety and depression. Formal support through counseling, support groups, and online self-help can help. Talk to your healthcare provider to be connected with supports that are right for you. Physical activity. The benefits of exercise are numerous. It improves our physical and mental well-being. The recommendation for exercise is 150 minutes of moderate-paced exercise per week. You can break up the amount of exercise however you'd like, aiming for at least 10 minutes at a time. When incorporating exercise into your lifestyle, set goals and progress your exercise slowly and safely. Always listen to your body and follow any restrictions for physical activity outlined by your healthcare provider. Include endurance, strength, balance, and flexibility exercises for a well-rounded exercise routine. Be sure to find something you enjoy for exercise, as this will greatly improve your chances of sticking with it. Cardiac rehab. Cardiac rehabilitation is an excellent resource for reaching your physical activity goals, whether you have experienced a cardiac event or have risk factors for heart disease. Cardiac rehab will also equip you with the knowledge and self-management tools to live a heart-healthy life. Let's take a look at what our cardiac rehab program has to offer. Cardiac rehab is a comprehensive program consisting of exercise and education to help you achieve your best heart health. Benefits of cardiac rehab include improved quality of life and reduces morbidity and mortality. Cardiac rehab is for those living with heart disease, who have undergone a cardiac procedure, have had a cardiac event such as a heart attack, or are at risk for heart disease. Our cardiac rehab program at the Chatham-Kent Community Health Centers is a 3-month exercise and education program supported by a multidisciplinary team to work alongside you throughout the program. Medical clearance is required from a doctor or nurse practitioner. At the beginning of the program, an intake assessment will be completed to review your medical history, medications, and individual risk factors. There is also an opportunity to work with a dietitian for nutrition education and counseling. Once medical clearance has been obtained, you will work with the kinesiologist to help develop an exercise plan that is best suited to you and your abilities. This can be done in person or through a home-based program. The team will work with you to develop goals and provide support and resources to achieve those goals. At the end of the program, you will complete a discharge assessment and review your personal risk factors and progress towards your goals. By the end of the program, participants should feel equipped with the knowledge, skills, and confidence to continue with a heart-healthy lifestyle. We hope you found this information to be valuable. The information links used in this video can be found on the bottom of each slide. Please note that this video is for information purposes only and does not replace the need for medical care or recommendations from your healthcare provider.